Then I want to follow up on this. I had a meeting with not Senator Kennedy, RFK Jr. Let me find the clip for you real quick. Had a chance encounter with him. Actually was supposed to have had a meeting with him, but that didn't happen. And here's the one question I was able to fire off.
I will. Real quick, Mr. Secretary. Real quick. I know you're trying to get out of here. This gentleman is the largest YouTuber on Medicare.
Oh, Medicare. Your HHS OIG has come up with a whole bunch of recommendations for CMS to help seniors not get screwed over by Medicare Advantage companies. But in the last few years, they've never implemented any of those recommendations from your OIG. Is there anything they can do?
Yeah, we got to go. Sorry.
I'll look into it.
Thank you, sir. Good to see you.
Okay, let's go.
He said he'd look into it. And then after that, well, actually that same day, I came back here to the office and went live showing those very studies that the Office of Inspector General, they look over the shoulder of Medicare and make sure they're doing the right thing. They found over $7.5 billion in Medicare risk-adjusted payments in 2023 alone were possibly fraudulent. They recommended that CMS conduct audits to validate the diagnosis reported on in-home HRAs so that they can not get scammed for upcoding, which is a very, very big deal. UnitedHealthcare is in a court battle over that right now. So Office of Inspector General says, hey, CMS, this is a problem. Billions and billions of dollars could be recovered. And what happened? CMS said, no, we don't concur with that. To the Office of Inspector General, we're not going to do that. Now, the Office of Inspector General reports to Secretary Kennedy. So he's over Dr. Oz. And he told me he's going to look into it. What's he going to look into? The fact that his own HHS, OIG, a lot of letters there, Health and Human Services, Office of Inspector General, said they should go and they should get this money back and they should audit more of them. Another one. They said they should go get them. So now, guess what happened? Just weeks ago, literally weeks after he said he would look into this, that they've already come up with a solution and nobody's implementing it. Guess what? Now they are. Now CMS will audit every single one. Every single Medicare Advantage plan will now be audited by them. They only had, what, maybe 30 before? Check this out.
News alert affecting some of the healthcare names. Bertha Coombs has the story. Bertha?
John, this afternoon, the Centers for Medicare and Medicaid Services saying that they are going to expand their auditing of Medicare Advantage plans. That auditing between 2018 and 2024, they say, has fallen behind, and they are going to put new resources to speed that up. Mehmet Oz, the CMS administrator, says we're committed to crushing fraud, waste, and abuse across all federal health care programs. While the administration values the work of Medicare Advantage plans do, it's time CMS faithfully execute its duty to audit these plans, he says. This is somewhat surprising, John, because many people thought of him as a real advocate for Medicare Advantage. He had been when he was on his show previously. One of the things they're going to be doing is they're going to be spending more on technology, and they're going to boost the number of coders from the current number of 35 to 2,000 by September.
Now, do I think that that's related to him telling me that he's going to look into it? Yeah, I do. Why? Here it is right here. I highlighted it for you. The Center for Medicare and Medicaid Services will audit all Medicare Advantage plans annually. That has never been thought of being done before. CMS will scrutinize all Medicare Advantage contracts each year and increase its auditing volume, the agency announced, dramatically increasing the number of employees conducting audits from 40 to 2,000. But wait, here it is. Look at the highlighted part. The agency will collaborate with HHS OIG, which has documented billions of dollars in inappropriate payments over multiple years. In October alone, OIG detailed there's as much as $7.5 billion in Medicare Advantage. So the fact that it literally points out, where did I go? Oh no, I'm gone. Literally points out that they're going to cooperate with the Office of Inspector General. I think that's a wonderful, huge thing. I don't know if it just came from me or not, I don't know. But one last clip here that I think it's critically important that you see, talking about the difference between Medicare Advantage and original Medicare. Please listen carefully to this and share this with somebody who's making the choice and they can afford a Medicare supplement plan and go anywhere with no restrictions and no denials. Here's a lawyer who defends seniors and helps fight for their appeals, telling her story. Listen to the difference here.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. This is despite the requirement that's been discussed that Advantage plans must offer the same benefits and apply the same coverage criteria as original Medicare. When a patient first receives a denial, they're thrown into a maze of red tape that is dizzying even to our experienced legal team. The initial denial is made not by the Advantage plan, but a third-party contractor using an algorithm. A computer determines what a patient's predicted length of stay should be based on millions of past beneficiary data points, not the patient's plan of care or the advice of their doctors. Then, at each additional level of appeal, if the patient actually chooses to fight it, the denials are upheld by quality improvement organizations with little to no explanation. If a patient is successful with an appeal while still in the facility, they can expect a new round of denials to start in a matter of days. Patients caught in this maze are forced to make a devastating decision: stay in the rehab facility and pay thousands of dollars out of pocket, or go home against medical advice.
Let that sink in. What the study showed, went over today. And if you want to see the study in great detail, by all means, go for it. It's found in the description of this video. 1 in 5 claims are denied on Medicare Advantage that would have been paid on a real Medicare plan, like original Medicare. It's not just inconvenient. That's completely wrong. And that's not me saying it. That's the US government saying it. It's not just researchers and regulators saying it. The New York Times recently ran a story about seniors who are denied rehab stays, which is so prevalent. If you've helped anybody with Medicare Advantage over the years, like I have, that is the most prevalent thing. They need post-hospital care, skilled nursing, and that is routinely denied. Cancer treatments, even necessary imaging, just denied. All because Medicare Advantage prior authorization delays. And when somebody says care delayed is care denied, justice delayed is justice denied, it's the same. It's absolutely right. UnitedHealthcare, the largest Medicare Advantage provider, faced lawsuits last year alleging that they used algorithms that she's talking about to deny rehab claims in advance before even looking at the patient's full medical file. This isn't just about statistics, and I'm not saying that they're wrong. I'm just saying it's an allegation in court. This is about real people being caught in the gears of corporate-run healthcare. So what can you do? Know that the plan that you're in has options when they routinely deny care for you. When it really hits the fan and you don't just need a new toothbrush from Rite Aid, you need real coverage. You have to fight for yourself. You have to have an advocate. Don't just go willy-nilly and signing up with a plan. This is my best advice. Get somebody who's accountable to you that will help you through the process. Someone that doesn't cost you a dime to use, but knows the industry and not just volunteering in it, but literally a professional in it. Just because it's called Medicare Advantage doesn't mean it works like original Medicare. If you're considering a new plan, ask, do you require prior approval for MRIs, for home health care, for rehab care? Work with an independent agent, someone who doesn't just push one company, not captive and not employed by one carrier, but somebody who can help you compare all the options based on your needs, not their commission. You should really stay informed, because I'm watching the news. I'm watching all the changes in Medicare world. And the bottom line is, with Medicare Advantage, and it's a growing part of the senior population now, but it comes with real trade-offs. These denials are not just a paperwork problem. They affect your doctor's ability to care for you. They impact the financial stability of your local providers. They could determine whether or not you get the care at all, just somebody in an office somewhere. I encourage you to stay connected, stay informed, and until next time, thanks for watching. God bless you. Make sure you subscribe. We'll talk to you next time.